Hello, everyone. Thanks so much for joining me today. My name is Lydia, and this is Time with Lydia, the pharmacist. A big thank you to all those who have subscribed to this channel. I'll be releasing one video every week. So if you want to learn more about your health, then please hit on the subscribe button and also on the notification bell so you don't miss any video that I upload. Today, I'll be spending some time with you talking about period pain. Medically, period pain is known as dysmenorrhea. It is a normal part of the menstrual cycle. It is the kind of pain that occurs in the abdomen, and it occurs as a dull pain or a very intense pain. This pain can radiate from the abdomen to the back and sometimes to the thighs. Period pain varies from woman to woman, and even in the same woman, the intensity can vary from period to period. It can be quite distressing, and this sometimes even keeps women away from work and sometimes from school. There are two major types of period pain. We've got the primary dysmenorrhea and the secondary dysmenorrhea. So first of all, let's talk about the primary dysmenorrhea. Primary dysmenorrhea is the one that occurs in women who have just started their period, and it's normally in teenagers and women in their 20s. It starts from 6 to 12 months after the first period. And what happens is it starts a day before menstruation and can last up to 48 hours after menstruation. It is characterized normally by nausea, vomiting, diarrhea, headache, sometimes mood swings, and bloating. This pain normally reduces as the woman grows older and sometimes after the woman has had children. Now let's talk about secondary dysmenorrhea. Secondary dysmenorrhea occurs in women who are of the age between 30 and 45 years. It is associated with abdominal pain that can occur a week before menstruation starts, and this pain can continue throughout menstruation. It is associated with vaginal bleeding after sexual intercourse, bleeding in between periods, and sometimes heavy bleeding. These symptoms occur as a result of some underlying conditions such as uterine fibroids, endometriosis, pelvic inflammatory disease, and sometimes polycystic ovary. All I want to say here is, if you are a woman who falls within that age category and you experience a sudden change in your period patterns, or all of a sudden your bleeding becomes very heavy, then there's a need to seek medical attention. So the question now is, what causes period pain? In women, the womb undergoes normal contractions without the woman realizing it. During menstruation, these contractions become intense to enable the womb lining to be shed. As the contractions take place, the blood vessels in the womb become compressed, and this prevents blood supply as well as oxygen supply into the womb for a short period. As this occurs, there is a trigger for the release of a chemical called prostaglandin. Prostaglandin further intensifies the contractions, and this is what causes period pain. It is known that the more prostaglandins that are released, the more intense the period pain. There are some self-help measures that you can carry out at home to help relieve the pain. And these include taking a warm bath or shower. Also, relaxation techniques can help because they take your mind away from the pain. A mild exercise like walking can help a great deal because exercise has been shown to help release a hormone that makes you feel good about yourself. Also, heat applied in the form of heat pads or a hot water bottle covered with a towel and applied to the abdomen can help a great deal. If you're someone who smokes, then start thinking about giving up smoking, because smoking can aggravate the pain. Excessive consumption of alcohol is not helpful as well. So reduce the amount of alcohol you take when you go through your period. A light massage around the abdominal area with an essential oil such as lavender can help a great deal. There is also a small device called the TENS machine. This is a battery-operated device that works by releasing mild electric current to the abdominal area. And this is a very good machine that can help relieve the pain. If you have done all these and you're still experiencing pain, then I would advise that you visit your pharmacy and speak to the pharmacist. There are painkillers that you can buy over the counter, and these include ibuprofen and paracetamol. Ibuprofen belongs to a group of drugs called non-steroidal anti-inflammatory drugs. These are drugs that prevent the release and the synthesis of prostaglandins. Remember, I said earlier on that prostaglandins intensify the contractions of the womb during period. So once ibuprofen is taken, prostaglandin release is prevented, and hence the pain can come down. If after taking ibuprofen or paracetamol and you're still experiencing the pain, then you can go ahead and visit your doctor. There are stronger painkillers that can be prescribed for you by your doctor. And sometimes you would be prescribed opioid-based painkillers like codeine, or sometimes oral contraceptive pills can be prescribed for you to help with the pain. When all these have been done and you're still experiencing pain, then the doctor would carry out a medical examination, and if there is a need, they would refer you to a specialist. I hope you have learned something new today. If you have, then please give this video a thumbs up. Remember to share with family and friends so we can all learn together. And don't forget to put your comments and your suggestions and any questions at all that you have in the comment section, and I will attend to them as soon as possible. Also, remember to hit on that subscribe button and also on the notification bell so you don't miss any video that I upload. It's been a pleasure having a chat with you. Thanks so much for joining me, and I hope to see you soon in my next video. Bye for now.